Coming up in this program, I meet with two inspirational women who are championing the subject of HIV/AIDS within Ghana, West Africa, each for their own distinctive reasons.
I had a daughter who was HIV positive. And if HIV is not getting close to you, you won't know what it is. But if it gets close to your door, that is where you appreciate what is called stigma and discrimination.
The Human Immuno-Deficiency virus, more commonly known as HIV, is a global epidemic, which has killed around half of the 78 million people infected with it in the world. Sub-Saharan Africa is most severely affected, with nearly 1 in every 20 adults living with HIV. But in Ghana, in West Africa, huge strides have been made in curbing the virus. Since 2001, when the country's HIV prevalence stood at 2.3% amongst 15 to 49-year-olds, this has almost halved, whilst the annual number of HIV-related deaths have reduced from 23,000 in 2005 to 10,000 by 2013. But the effects of the HIV virus and the impact of its partnering syndrome, AIDS, on people's lives, their families, and the country remain horrifically real. Firstly, I'm invited to the home of Charity Owusu-Danso on the outskirts of the capital, Accra, to speak with her about how she initially contracted the HIV virus 13 years ago. So Charity, take me back. How did you first contract HIV?
Well, it started in the year 2002, later part of 2002, when I was once married to a gentleman, and he started feeling sick. We don't know what was wrong with him, and he was like, whenever he's sick, he preferred to treat himself at home, not going to the hospital. So one day he decided to go to the hospital. I said, oh, glory be to God Almighty. So when we got there, the doctors tried to do their own thing, trying to know what was wrong with him, and they couldn't. So it was then that one nurse came and said, the way this thing has been happening, let's try HIV test. So we took the blood sample, and within 3 days when the results came, he has passed on. So after that,
Hold on. When the results came, he was
dead.
He was dead?
Yes.
Wow.
So we couldn't have the chance. I couldn't have the chance to ask him how he got it, when, and all that. So after the burial of the funeral service and everything, when we came home, it clicked on my mind to go back to the hospital and see exactly what killed him.
It was upon her visit to the hospital that Charity was told that her husband had died from HIV, and following tests, that she too had contracted the virus. So your initial reaction that, okay, yes,
I was denying.
You're just in denial?
Yes. Wow. So I denied until a certain time that I realized that I was dying slowly.
How long did it take?
Just about within 1 year.
A whole year? So yes. You went back home, didn't tell anybody for a whole year? Wow.
And I was also afraid, because of stigma and all that. So I decided to hide myself.
How bad was the stigma at that time, in those times?
Very, very bad. Because those days, when you are selling even cooked food, nobody will buy from you. Even when you are buying from somebody, they will not sell it to you. That was how far the stigma goes. And if people get to know and you are living in the same house with them, life becomes so much unbearable for you. Life becomes so terrible. You become like you are not part of society. Okay, but what I also realized is I felt people should understand that it was not my fault, or it was not anybody's fault to contract HIV. But what we Ghanaians have at the back of their mind is the moment you are positive, you are promiscuous. So if this woman has HIV, then she is promiscuous. Meanwhile, I was happily married woman with my children, living together happily. Then HIV came. So people just get up and judge you this way. You become defenseless.
So how different is your life now? You know, more than how many years?
13 years.
More than 13 years now.
Well, it's wonderful, because had it not been the antiretrovirals, I think I would have been in a grave by now. It's such a great joy. Moreover, seeing your children growing by your side each and every day. And I'm so happy to be alive.
2 years after starting the antiretroviral treatment, Charity married her second husband, who is HIV negative. 7 years ago, she delivered their first child together, Janai. And just 6 months ago, their daughter, Lady Adelaide, was born. Thankfully, both children are HIV negative, due to the strict medical advice that both Charity and her husband had to follow throughout the pregnancy. You and your husband have a son together, and this is your last born. Tell me the process when you decide to have children. What needs to happen in order for you to reduce the risk for mother-to-child transmission?
When we were ready for baby, we went to the hospital, and at that time I have started the antiretrovirals, which has obviously helped my immune system to boost up and my viral load to come down and all that. So we went to the hospital and we told the nurse we want to start having children. And so they did the normal test that they have to do on me. So they gave us the go ahead. They read my menstrual cycle, and they told me when we can have the unprotected sex, and we did it. We have the unprotected sex, and we conceived the first son, the first child, who happens to be a boy who is now 7 years old.
Oh, wow.
Yes.
Wow. So your son is now 7. When you first delivered and you got the news that he's HIV free, how did that make you feel?
I feel so happy, and I have a lot of joy, and I realized that there is hope for, there is hope in the future. Like, people might think that with this situation there is nothing you can do, okay? But I realized that having that boy not, infect the baby, it was such a joy.
So when you decided to conceive, I know you obviously were taking antiretroviral drugs, but did your husband have to take any special medication? And also when your baby?
The only person who has to take medication is me. But after the delivery, the baby, they have to take what we call the post-exposure prophylaxis for 6 weeks. That's also a type of antiretroviral, and it will cease the establishment of the HIV, if by chance the baby has been infected, through delivery.
In addition to being a mother and a wife, Charity has for the last few years become an advocate of Ghana's HIV/AIDS awareness campaign. She spends much of her time attending community outreach programs in her capacity as a heart-to-heart ambassador for the governmental organization Ghana AIDS Commission. Today, I'm joining her at an event in Bawe, on the outskirts of Accra, which is being supported by the First Lady of Ghana, Her Excellency, Mrs. Lordina Mahama. A major part of charity's role is to break down the stigma and misconceptions about the virus through promotional messages and one-to-one interactions with participants.
Charity, there's a lot of things happening here, you know, the screenings, so many people in the community coming out to be tested for HIV and other diseases. Why do you choose to be so brave, I think, and put your face out there, telling the people about your status and what you've been through?
Actually, the main reason for putting my face there is that a lot of people are dying, and these people are in the community, and Ghanaians have this perception of believing in traditional healers, believe in pastors, but they really don't want to go to hospital whenever they are ill. So somebody like me putting my face there, to telling them that yes, it is real, it is there, and I am alive because of treatment and the help of other health workers. That's why I'm surviving. So I have put my face there just to let the community know that there is hope.
Okay, and lastly, I mean, I'm looking around at the different people here. Do any of them kind of approach you after? Because I saw you on the microphone, the press is there watching you, and like look at you like, well, you don't look sick. You don't look like somebody who has HIV.
Yeah, just as I said, somebody just approached me at the back when the First Lady was speaking, and she was like, I thought they say people living with HIV looks like skin. In fact, I was not expecting somebody like you. I said, yes, this is how it is. You have to understand that now when you are looking for a skinny and a skeleton person living with HIV, you won't find it unless the person decides not to go for treatment. But if the person decides to go for treatment, there are so many people living with HIV right in our midst here. I know them. Do you understand? But you never know it until they tell you that I am positive. And it is because of the treatment.
Part of Charity's advocacy role as an ambassador for HIV is to visit hospitals on a weekly basis, encouraging people living with the virus through her own testimonials. Today, she and the governmental campaign's other ambassadors are at Ridge Hospital, one of the largest in the capital, talking about the importance of taking medication consistently. It is also being filmed for a television awareness campaign.
Action.
So please, I will encourage you to be more consistent with your medication. If it is 8 a.m. you have set for yourself, make sure that 8 p.m. you take it. And it has worked for me, so I encourage you to take it, and it will help you very, very well.
It's humbling to watch Charity speak openly about her status, but I'm keen to ask her if this has come at a personal cost.
Your face is on posters, you're in the media, you put yourself out there. Is that an aspect that you ever worried about when you're getting involved with as a heart-to-heart ambassador, knowing the fact that there is still stigma, and by you getting out in the media and showing your face boldly that I'm a person living with HIV, I'm healthy, that people would turn that against you almost?
When I was just about to be one of the ambassadors, it was not a problem. But when I got to know my status, then that was
13 years
that
ago.
is 13 years ago. It was a problem for me. But as education and my capacity is being built as time goes on, I tried to break what we call the self-stigma. That is, I don't want anybody to know my status. I want to be alone. I start pulling myself from those issues, start thinking positive
on taking positive measures to myself, and based on that, I break that stigma, and I felt like coming out is just easy for me to know. And I realized that it is a thing that when you do, you become free. Initially, when you talk about your status in public, in front of other people, you tell people about you, it becomes like a medication that you have taken, and it gives you a lot of relief. So I realized that it is good, and now I'm out.
It's so gratifying to hear Charity talk so positively about a subject so often discussed for negative reasons. Following our chat, Charity introduces me to a lady who has helped her and 6,000 other people living with HIV in Ghana. Mercy Akwa-Hayford, more commonly known as Auntie Mercy, was the nurse who detected Charity's first husband had HIV and encouraged her to also have a test and subsequently be treated for the virus.
She has been one of my mental helper all through these years of living with HIV, and she tries to encourage me each day.
All right, so I think Auntie Mercy, I'd love to, know more about the work that you do.
Okay.
So can I steal you away, and then we can have a chat?
Okay.
Thank you so much, Charity. Thank you. All right.
Auntie Mercy has worked as a nurse for almost 30 years. And 10 years ago, she single-handedly set up an antiretroviral therapy clinic for HIV patients at Rich Hospital. Despite a lack of staff and financial support, she says the biggest challenge initially was the stigma.
When the ART started, we were using 2 consulting rooms at the outpatient department. And when we send our clients, the clinic was being run in the afternoon at 12. So we send clients to the OPD to go and get their weights and their BPs checked. And then there's a problem. They were not allowed to stand on their scale. These are nurses that are trained. They know the mode of transmission. So we had to get our own logistics to run the clinic.
I want to know about you, just kind of hearing the struggles to even get this center established. I'm just thinking, why in a time when there was so much stigma, you're saying your fellow nurses wouldn't even let patients stand on a scale. Why would, at the time when some people were running away, were you running towards HIV, and helping those who have the infection?
It's compassion to do the work. If you don't have the passion, so me, if I'm selecting people into ART care, I want people with the passion. If the person has no passion and you bring the person here, he's not going to work. I had a daughter who was HIV positive. And if HIV is not getting close to you, you won't know what it is. But if it gets close to your door, that is where you appreciate what is called stigma and discrimination. Your own colleagues will discriminate against you. Your own household will stigmatize. So that is how I got into HIV.
Each day, the clinic treats around 100 people, educating them on safer sex practices, as well as prescribing patients with the necessary antiretroviral medicine to ensure they live a healthy life with the virus. Thanks to such measures, in hand with national awareness-raising campaigns, over the last decade, Ghana has had a significant increase in the number of pregnant HIV-positive women using ART drugs, with 76% taking the necessary medication in 2013. Consequently, this has reduced the number of babies being born with the virus, a major aim of the clinic.
First response.
To see their work in practice, I observed Clarice, a midwife, carrying out an HIV test on a pregnant woman. Whilst it's already believed that the woman does carry the virus, it needs to be confirmed before she can start taking the necessary ART medications to prevent her passing HIV on to her unborn child.
Yep. My client is positive to HIV 1 and 2.
Okay.
You can have a look. You see the 2 lines down are very faint, but that is positive.
Wow. Okay. You know, so just speaking with her, she's saying she has a 6-year-old in her
Child.
previous pregnancy who they, you know, she followed the medication at the time they gave her. That child is HIV negative.
Yes.
So if she sticks to this medication, hopefully this new baby too will be HIV negative.
Yes.
Alongside her full-time job as a nurse, Auntie Mercy also runs the Ghanaian arm of the South African-based charity Inarela, the international network of religious leaders living with or personally affected by HIV and AIDS. The charity aims at tackling the issue within religious circles through training and free screening. This morning, she and her team have been invited to speak at a church service in Accra.
The outreach we're going on today, you know, what can we expect?
We are going to a church which is now HIV competent, because the man there that we are going to is the chairperson for Inarela Ghana, and he is living with HIV, a man of God living with HIV together with his wife, and he has been able to sensitize the church, so they are aware that HIV, it is not the picture we used to see so many years ago, but HIV has a human face now. So we are going to the church to talk to other members and also do screening for them, so that they will know that HIV, if you are positive, you need to be embraced, not to be thrown away. Persons with HIV will not die today. If God gave them 90 years to live, they will live. It's now 77 years.
Auntie Mercy speaks to the congregation about the HIV virus itself, as well as educating them on safer sex practices. Following the service, whilst members participate in free screening for sexually transmitted diseases and HIV, I speak about the impact that Auntie Mercy has with the church pastor, Reverend Azuma, who is HIV positive.
I met Auntie Mercy for about 8 years ago, and she's a nurse at the Rich Hospital, and those days they will encourage us, Reverend, don't worry, all is well. You are not the only person. A lot of people come to my clinic who are pastors, who are ministers. We give them medicine. So don't worry, life will be well. She has encouraged me, and I know not me alone, to other people. And we need to celebrate her. She is doing a wonderful work. And if we have more of such women in society, our society would have been a better place.